Hi, I'm Dr. Leena Jain, plastic and reconstructive surgeon working in Mumbai. You're currently at Plastic Post Clinic. Today we are going to talk about earlobe hole surgery. So most women and a few men do have earlobe piercings. Sometimes over the course of your age and wearing lovely long earrings, the earlobe hole or the piercing gets elongated. Sometimes it gets elongated to the extent that it completely divides the earlobe and makes it into two slits. Other times you have done it once, you are in a hurry to put back the earring and it again elongates. You again repair it and then you make a new piercing and that also elongates. So these are the multiple problems that can occur or happen over the course of a few years once the earlobe is pierced. Now let's come to the first thing about what is to be done. Earlobe hole repair or the piercing has to be repaired by a surgical procedure. The surgery is a small procedure done in the operation theatre under local anesthesia, wherein the earlobe piercing is sutured from the front and behind and closed completely. Then you come back for a new piercing. Now this new piercing should be done not before 3 months of the repair. The reason is, at the end of 3 months of any skin suturing or repair, it regains only 50% of the original strength. And that is the minimum strength that you need to prevent a recurrence of this problem. If you are in a hurry and you get the piercing done earlier, then you're going to be back to square one in a few weeks' time because it's going to elongate because of the inadequate strength of the original repair. The second important caution that one needs to bear is the new piercing should be done away from the site of the repair so that you're doing it in a fairly healthy skin and that does not elongate. The third thing is that when you're going to do this new piercing, you're going to wear a very small stud for at least next 3 months, and then at the end of 6 months, you're going to switch on to your regular earrings. So a lot of women come with a few DIY treatments or saloon treatments that they have used a paste or a gum and it was good for a few years and now it's elongated. But in fact, we have seen a lot of these treatments going wrong and causing devastating results of the earlobe, sometimes damaging the entire earlobe, that it needs a major surgery to reconstruct. So please be careful and don't get carried away for shortcuts because this needs a proper surgical repair.